Autism spectrum disorder, or ASD, is an umbrella term encompassing a range of early-onset neurodevelopmental disorders typically characterized by a continuum of disabilities with profound or severe limitations to everyday life. Autism is considered a spectrum disorder as its clinical manifestations are extremely multifaceted, differing from person to person. Individuals with ASD experience limited capability for communication and social interaction, and often exhibit repetitive, stereotypical behaviors, narrow scopes of interests, and in some cases, disordered language development and mobility problems. The severity of the symptoms of ASD defines an individual's function. Those in the mild range may function individually, while those with moderate to severe symptoms typically require substantial support. Diagnosis of ASD is typically made by a physician in accordance to criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5. As ASD is a highly complex disability with no definitive cause, clinical diagnosis is primarily based on observations of an individual during early childhood. The current requirements for the diagnosis of ASD are based on persistent deficits in two main categories. Category 1 outlines deficits in social communication and interaction skills, such as reciprocity, maintenance of relationships, and lack of nonverbal communication, such as understanding and using facial expressions, hand gestures, and maintenance of eye contact. While the second category outlines the requirement of the individual to exhibit restrictive and repetitive behaviors such as fixated interests, strict routines, repetitive sounds and movements, and reactivity to increased or decreased stimulation. Different approaches, including clinical assessments, neuroimaging, and neuropathological studies, have been used to assess the structural and morphological brain abnormalities in ASD. Although the etiology is not precisely defined, a strong relationship between ASD and early alterations in the neurodevelopment of the brain's morphology, function, and neural wiring is theorized to be a probable cause. Currently, the most prominent theory of the neuropathology of autism is regarding aberrant brain overdevelopment in the cerebellar structures. During early development, altered total brain volume has been shown to be a consequence of a persistent period of abnormal head growth from the first year of life through to early childhood. The significance of these findings is that the time coincides with the development and myelination of the pyramidal neurons, which are the primary excitation unit in the prefrontal cortex. Abnormal development of these neurons is a likely inhibitor to the normal development of the brain, and thus has serious implications for the formation of precise circuitry and consequential normal function. The cerebellum is one of the most important structures in the brain, containing the largest number of neurons and synapses of any structure in the central nervous system. The cerebellum is implicated in motor function and more recently has been found to be involved in higher cognitive functions essential for many of the processes that are compromised in autism, including language and communication, social interactions, stereotype behavior, and motor capabilities. A characteristic finding in the cerebellum of the autistic brain is a significant reduction in Purkinje cells and is seen in about 75% of cases. Purkinje cells are responsible for fine-tuned motor control, balance, proprioception, and communicating information from the cerebellum to the cerebral cortex. Animal studies have also found ASD-like symptoms can be induced by specifically targeting Purkinje cells, suggesting their reduction plays an important role in the neuropathology of autism. Knock-on effects in multiple regions of the cerebral cortex have been attributed to disordered development of the cerebellum. Thus, the multitude of regions and pathways the cerebellum typically forms reciprocal connections to are affected, and are likely to account for the system-wide behavioral deficits seen in autism. Another significant pathophysiological mechanism in patients with ASD is hyper-excitability of circuits involved in sensory, social, and emotional processes. The imbalance between excitation and inhibition of GABAergic and glutamatergic neurons have been shown to increase depolarization of cells for a long period of time in people with autism. GABAergic pathways play important roles in development of an inhibitory cortical system, and the interplay of glutamatergic and GABAergic systems facilitate formation of the cerebral cortex in early development. Imbalance in the ratio between excitation and inhibition is believed to be a potential mechanism contributing to developmental dysfunctions seen in autism, specifically in patterns of information and sensory processing as well as social behavior. Although there is extensive research into the neuropathology of autism spectrum disorder, much more research is needed to comprehensively understand its complex and multifaceted nature in hope of solidifying our knowledge of its developmental path.